Good afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. This is KMET 1490 AM, ABC News Radio Live. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in beautiful Encino, California. And I'm offering you this program along with Dr. Robert Jaffe, who is also a licensed marriage and family therapist, a certified hypnotherapist, my very good friend and colleague and business partner.
Thank you.
Welcome, Dr. Jaffe.
Thank you. So we're here to help you in any way that we can with information, thoughts, and ideas about how to be more loving and joyful. This program is devoted to being more loving and joyful in your relationships and especially in your sexuality. We say at the beginning of the program that we are born into this world as our loving, authentic, true selves. And we come in with many good qualities. We come in open to learning new things. We come in curious about the world. We come in emotionally available, meaning that we can connect with other people, other people's experiences, other people's feelings. We have the ability to be compassionate. And we are actually trusting when we come in. We think that the world is going to treat us well, and with some people it does. And the other thing we come in is as sexual beings.
Right.
We are all sexual beings, and we are here to celebrate that. It's one of the great joys of living is our sexuality, and so that's what our 3 o'clock hour is devoted to, is our sexuality and our relationships and how to make them more joyful and loving.
Exactly. Thank you for that wonderful introduction. And we would like to hear from you. Please call us 951-922-3532. And if you wish to have a conversation with us privately, we understand. So please use our contact information to do that. And those information are available at KMET TV program website. So glad to have you here with us. And as usual, we're going to start with the hot topic of sex and sexuality.
Let's get to it.
Let's get to it. So for today, I was just thinking, okay, what do I say? I mean, it's summer, right? It's hot. I mean, everybody talks about, hot sex and all of that, right?
Mm-hmm.
The people taking hot vacation, everything is about hot, right?
Mm-hmm.
So the question comes to me, when talking to some people are not that hot actually about sex.
That's true.
Right? And then they say, really, is sex really important for us to keep our relationship?
Mm-hmm.
Right? And then for some people, that's not really important. Like I have a client who told me that, he has anxiety. He doesn't know why. And then he said he hasn't been having sex with his wife for the past 2 to 3 years. And instead he does gambling and he's having fun.
Oh,
okay.
So gambling is more fun to him than sex.
Than sex for now, right? But he's not able to bring the two together yet.
Mm-hmm.
So we're processing that.
Mm-hmm.
But that's a very interesting, scenario to look at.
He hasn't tried gambling with his wife at the table, and they both get really excited and then run upstairs.
Here's the thing: they use 2 different tables to do that.
Oh,
right.
Okay.
So I guess that's how they have been able to respond to their excitements. I don't know, right? So
Mm-hmm.
we'll see where would that end up. You never know, right?
Mm-hmm.
When you have a client and every time they come in, every time it's a brand new time, right?
Uh-huh.
Every time there is a new surprise, every time there is a new finding. So you really can't tell where it goes. I mean, there are some anticipations, but really we don't know that, right? We don't know. But what I know is that, and of course, I'm not saying this to him yet because he needs to get to that part, that a part of her anxiety maybe is associated with not having sex, right? And he's young. I mean, he's like about, 65 or so?
Oh, he's 65 years young.
He's 65 years old.
Oh, I thought you said he was young.
He is young. 65 years is young. 70 is young. We get to old ages these days, maybe around 80, 85. I mean, life has changed these days.
So if 70 is young and 80 is old, we only have 10 years of being young?
No, you have, your whole lifetime up to, up to that age to feel young. And even at that age, it's up to you if you want to feel young or not, I
Well,
mean,
yeah.
age is only a number. It's, how you see yourself and how you function and how you enjoy your life and how you're capable to have sex, or how do you define sex actually, it's a factor here.
Okay.
Right. So we will get to that, right? And I think that's an important factor. What do you consider sex? Having sex. What I tell to my clients, having intercourse is a part of being sexual towards each other,
Mm-hmm.
right? So sex actually starts with, having intimacy, having, I know you're going to pick on my pronunciation of intimacy. So anyway, sorry. Well, English is my second language, so sue me okay, for that.
Well, when
Intimacy.
but when you say intimacy, what goes on in my mind is sex can be about intimacy, and it can also not be about intimacy.
Can be not about it. Yes,
Right.
exactly. It can
Yeah.
be both ways. However, people can have intimacy and not having intercourse. Right.
Yes, of course.
Right. So the answer, is sex, must be a part of a relationship. The answer is maybe yes, maybe no, depending on the couple,
Mhm.
right? Depends. So, is it an important part of a romantic relationship? Realistically, when we look at, the relationships and the types of them and all of that, we can't say, it's not like a cookie cutter. It's not like a one size fits all kind of a thing.
Mm-hmm.
For some couples, sex is an important aspect of it. For some, it's not, right? And then the reality is that everybody, looks at sex and sexuality differently, and there is no wrong or right way of having sex, and there is no right or wrong way of including sex in the relationship, right? So to maintain, an intimate relationship, to maintain a close relationship, sex really isn't necessary to have. And those who believe in that, there are a variety of reasons for it. For example, people can be happy, they can have a fulfilling relationship, they can have, an intimate relationship without being sexual with each other.
That's true.
And then there are reasons for that, right? So some people accept their body's, responses. For example, there are people who have low libido,
Mm-hmm.
right? So they accept that.
Mm-hmm.
They don't challenge that. They don't use that against each other.
Mm-hmm.
Right. So that's one of the reasons that people may not want to include sex into their relationships.
Yes.
Right.
And of course, if both people have low libido, then it's a good thing.
Then it's a good thing. Some people, they have some medical issues going on with them.
Mm-hmm.
So, having medical conditions can be an underlying of experiencing low libido.
Mm-hmm.
Or maybe they're giving them some sort of bodily limitations in terms of body functioning,
Mm-hmm.
that doesn't allow them to, enjoy their sex life.
Right.
Right. So that's another one, right? Some people, due to a variety of factors, they want to take their time getting to know each other
Mm-hmm.
before they become sexual with each other.
Yeah. Yeah.
Right.
And that could expand into if the person. I mean, everybody has their own sex drive, which you termed libido. That's
Right.
That's the right word. But also, people have emotional intimacy problems.
Right.
and sometimes that expands into their sexuality.
Exactly. So that's another factor, and I'm glad you brought it up,
Mm-hmm.
right? There are people that they're just simply afraid of having sex because they believe sex may ruin the relationship.
Mm-hmm.
That's another factor, right?
Mm-hmm.
And I have heard that from quite a few good couples,
Mm-hmm.
in my practice, and
Mm-hmm.
they're afraid to initiate sex, in particular for those that they had sex at the beginning and then they stop, not going back to their sex life is difficult for them.
Mm-hmm.
They think that what they achieved in between actually can become ruined again.
Mm-hmm.
And they just rather to keep the relationship as is,
Mm-hmm.
instead of going through the challenges of having sex, because that's how they perceive it. Or some people, some couples, they rather keep the relationship and they have never had sex and they want to keep it that way.
Mm-hmm.
Right.
Yeah.
And then there are some group of people that they believe sex before marriage is damaging.
Mm-hmm.
So that has something to do with a cultural factor and religious factor.
Right.
Right. And then even when they are able to have sex legally, and all of that, they're married or anyway they are in their relationship, right?
Mm-hmm.
They still think that maybe sex is not a good idea.
Mm-hmm.
And then some people have very limited sex because they think about just having a child.
Mm. Yeah, they believe
Right.
that sex is solely for procreation, and so if they don't want to procreate,
Right.
then why bother?
Why bother? Exactly.
Mm-hmm.
And then so as we see, as much as sex can be, considering with all the, all we hear about sex, all we hear about, sex should be like that or should be that this way or should be, perform how many times per week or, I mean, that of course varies among the couples. It has, it has to do with age, it has to do with beliefs, perceptions and everything,
Mm-hmm.
right? For a good group of people, sex is not as important as we believe or people believe or general public believe is important for
Mm-hmm.
them.
Mm-hmm.
Is there something wrong with that? I personally don't think so,
Mm-hmm.
right? Because we're supposed to feel free to choose, what works for us.
Right.
Right.
Absolutely.
Just because two people are, married or they are in a relationship and they consider themselves a couple, it doesn't mean that they must have sex in order to maintain that type of relationship.
Yeah.
Right.
Well, we call it shoulding.
Right.
SHOULD. Shoulding.
Right.
Shoulding on other people.
Right.
Or shoulding on ourselves.
Right.
Which is the opposite of what you want.
Right.
When you tell yourself I should, you're not talking about what you want. You're talking about some belief that there's a right and wrong, and you know what's right or wrong.
Right.
And when you impose those beliefs on people, people don't appreciate it.
Exactly. Exactly. So we just got a notice that our commercial break is approaching. And with that, I invite you to please join us again after a few minutes so we can talk about, why sex can be important for some people and not important for a group of people and which way is the right way,
We'll talk to you in a few moments.
In a few moments. Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM ABC News Radio Live. Dr. Robert and Dr. Mitra here. Dr. Robert is going to join us in a few seconds. And for those of you who just joined us today, we're talking about, if sex is an important part of a relationship, and there are some people that would like to have sex, and there are some that they don't care for that, and which one is the right one, right? So we would like to hear from you and from your stories. Our phone number here live is 951-922-3532. And please call us. Let us know what is your story, what is your experience, and what do you think about, what sex brings to your relationship, and why is that important to you, or why it is not important to you. And we appreciate you choosing our program to be with us. And we know you have many choices to choose from. And we thank you that you're here with us today. So, Dr. Jaffe, welcome back.
Thank you.
You're welcome. And then, before the commercial break, we were talking about why sex is not important to some people, right? Or they don't apply, sex to their relationship.
Yeah,
right.
And of course there are a number of reasons for that.
Right.
And one major reason, of course, is that there's been some sexual abuse in their background,
right.
Which gave them literal and figurative bad taste around sex or around certain sexual activities.
Right.
And of course, when that happens, then the person has mixed feelings.
Exactly.
And usually therapy is needed in order to help resolve that, so the person can feel much better about themselves and much better about their sexuality.
Right. Exactly. That is the case. With that, do you think there's something else that we want to add to why people may not want to add sex to their life, besides the sexual abuse and the medical conditions and cultural and religious belief, and simply they want to keep the relationship that way? They believe that's the healthiest way.
Well, yeah, but also, like you said, low libido.
Low libido, yes.
Right. So the person doesn't have a strong sex drive. Because we all come in biologically different.
Right. Exactly.
So even with what they're talking about now about gay rights and about LGBTQ,
LGBTQ.
TQ. Thank you.
Sure.
Those, that's about learning to be more understanding of the human condition.
Exactly.
And that we're all human, and that we're all much more alike, far more alike than we are different.
Right.
But we focus more on the differences often, and that leads to prejudice. And prejudice, of course, means to prejudge.
Right.
And when we are prejudged, we hate it. And when we prejudge others, they hate it. And of course, that causes a lot of strife, a lot of unhappiness, and a lot of needless pain in the world.
Exactly.
So it's the same thing with sex drive. If somebody doesn't have a strong sex drive, they don't have a strong sex drive. It doesn't say anything about them as far as their worth as a human being.
That is true. Still, with everything, we always want to rule out the organic causes. If people are not willing to have sex, we want to be sure that that's a choice, and not because of a medical condition that's not been identified. So it's a good recommendation that if there is a concern there, to check with your physician to be sure that nothing's going on health-wise and you're choosing not to have sex because that works for you.
Yeah, and when you use the word physician, I flash back on all the work that you did with your doctoral dissertation.
I take that back.
and one of the things that you did was you sent out a questionnaire to physicians to find out how much physicians actually check in with people about their sex life and about whether they're having an enjoyable sex life.
Right.
And found that it was pretty remarkable how often that doesn't occur, and how often people generally don't even bring that up to the physicians, and the physicians don't ask, sort of like a don't ask, don't tell thing, which leaves the person feeling, if the person is having a problem, leaves the person feeling kind of lost and frustrated.
Exactly, and I'm glad you brought that up because it's a very important subject to focus on. You're right. Don't tell, don't ask, don't say anything about it. So it goes in the hiding on both sides, the physicians and the patient, right? And then in my research, which lasted a few years, and it still is going on, of course, and I'm expanding it. The more I learn, the more I expand it. I learned that, the problem even, it starts at home for physicians too,
Hmm.
right?
Well,
Because they grow up with a culture that, promotes tabooness of sexuality. And then when they go to medical school, the medical school program only focuses on reproductive care
hmm,
and only focuses on sexual transmitted infections and sexual transmitted disease prevention,
right.
right? There is no talk about what is human sexuality, why sex is essential for life or it is not, or whatever about sexuality is not communicated, is not taught, and because one, there isn't a budget for it. Okay. Two, culturally, sex besides reproductive care is not really a topic of, teaching or a topic of exploration, which is so limited. And I also found out that only up to 20% of physicians proactively, communicate about, patient sexuality. And only, and even I know that gynecologists had very low percentage in that, but which was a surprise to me. And or urologists, they had a very low percentage of being proactive, asking about, their patient's sexual, relationship or sexuality in general.
Hmm. Right. Yeah. And so the taboo against sex has been, I'm not going to say ubiquitous throughout the world, but it's been very widespread.
Yes.
And every country, of course, has um, their own cultural beliefs of the do's and don'ts and what's okay and what's not okay. However, um, you would imagine that physicians would have training in helping people understand what's going on with them sexually, especially if there's problems.
Right.
But physicians are not really well trained for that, and often physicians don't take responsibility for the fact that they're not well trained and say, this is an area that I'm not well trained in, and I think you need to go see a sex therapist, for example.
Right.
Yeah, yeah, some do, but the vast majority don't do that, and I think it's too bad, and it's something that we're hopefully trying to correct doing this program, for example.
Exactly. And one of the reason I'm promoting, this program this way is because, if physicians don't ask us about our sexuality, it is up to us patients to become proactive about our own sexual health care.
Hmm.
And, the more we ask about it, the more physicians are going to be liable to learn about it. The more universities are going to have to promote that part of the program that is a big missing factor in human healthcare, both emotionally and physically. So if physicians don't want to talk about it, we can,
Yeah,
right?
yeah.
And it's time for us to put the tabooness of sex aside, because it's up to us. I mean, who's carrying the taboo, concept of sexuality? Who's carrying it around? We do. So the more we talk about it, the more it becomes a common subject, and the more research and the more education will be provided about it.
Hmm. Absolutely. Yeah.
Right.
And again, it has to do with well, sex being taboo has a lot to do with early religious beliefs.
Right.
Yes.
Yes. And yeah, and the fact that sex needs to be only about, having children, and that's why, sex needed to happen only within marriage,
Hmm.
between a male and a female.
Right.
Right.
Yeah. And I think also a big part of that has to do with the fact that um, people, because sex is such a powerful force within human beings, I think in early religion and even to some extent in current religion, it's considered something that can't be controlled by religious leaders.
Right.
So what they do is they try to make sex something to be afraid of and ashamed of,
Exactly.
so that it can, so that religion can have the kind of control over people that many religions have tried to exert and still do exert.
Still do that, yes.
Hmm.
And then, even in some religions, they even suggest how to have sex.
Hmm.
They suggest that nudity is not part of sex,
Hmm.
right?
Yeah.
So it's not just, but as long as you make a baby, you're done,
Right.
right?
Yeah. Through a hole in the sheet.
Through a hole in a sheet.
Hmm.
Yes, yes. So having said all of that, still we know that sex, can be important for many people, right? Many people, they believe sex is part of their romantic relationship, right? Many people use sex as their intimate connection
Hmm.
with each other,
Hmm.
right? And that is correct, right? And then, so there are many reasons, for that, right? For those who like to have sex and love to have sex in their as part of their relationship, they use that as an opportunity to bond with each other,
Correct.
right? It's an opportunity to show, your partner that you love them and how much you care for them, and show them how much affection you have for them.
Hmm.
Uh, Also, sex provides security in relationship for the couple.
What do you mean by that?
So if they provide sex to each other,
Yeah.
that means they're going to keep the relationship,
Mm.
that's a problematic area,
Hmm.
because it's not the sex that keeps the relationship, but it's the intimacy and understanding and a healthy communication, and being open and vulnerable to each other, that keeps the relationship.
Yes. Um, I think what you're also talking about is in monogamous, sexually exclusive relationships.
Yes.
Yeah.
Exactly. And then, it's a source of pleasure for the couple when they
Sort of.
have pleasure.
Sort of.
Sort of. It is believed that way,
Uh-huh.
right? And then, it's also for those that they want to have children,
Hmm. Of course.
right?
Yep.
So you pointed out something very, very important, that that sex, is a security for the relationship.
Oh, you said that.
I said that. Yes. Okay. I said that, right?
Yeah.
Oh, no, you said pleasure.
Pleasure.
Pleasure. Yeah. It's supposed to bring pleasure, right?
Yeah.
And you said supposed to.
Supposed to.
So
Right.
tell me more about that.
Well, sex is, as far as we are aware, as clinicians and as researchers, uh, the two major forces in a human being. The most powerful force is our desire to survive. It's our survival instinct, and the second most powerful is our sexual drive. And so, um, I don't think that we would have a strong sexual drive, the vast majority of us, uh, if it wasn't so pleasurable.
Right.
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 And so pleasure is the motivation,
Mhm.
and pleasure is something that most people want. We want pleasures of all kinds, right? But physical pleasure with our bodies is very, very enjoyable, and it makes us feel and it makes us feel complete in a way that no other activity can.
Yes.
Yes.
Right. However, the danger part is for keeping the relationship falls on those that they believe by providing sex, they are keeping a healthy relationship,
Hmm.
right?
Yes.
And we know that's not the case, at some points, yes, sex is it can, of course, keep the relationship, secure. However, providing sex as a sort of security in the relationship is not going to work in the long run,
Right.
right?
Correct.
And so, we got a notice of a commercial break. When we come back, we're going to be talking about, you know, how couples can benefit or are benefiting from having regular sex within their relationship. So we are going to have a look at the emotional aspect of it, the physical aspect of it, and some other form of benefits that couples receive from having sex with each other. So see you shortly after a few more minutes.
Please stay tuned.
Welcome back to our commercial break. This is Heart-to-Heart our program, and Dr. Mitra and Dr. Robert here at KMET 1490 AM ABC News Radio Live. You're listening to a program on is sex an important part of a relationship? So we talked about why some people don't have sex, why people add sex to their life, to their relationships, and then we're going over, what makes sex an important. What's the benefit of it for those who keep sex in their relationship, right? So there is a component of emotional, factors, right? When people have regular sex in their relationship, and that being regular doesn't mean every day, doesn't mean for everybody, doesn't mean 3 or 4 times a week, doesn't mean when. For everybody that's regular having sex, the number of that is different. Some people have sex once a week, some people have sex twice a week, some people have sex 2 times a day or 3 times a day or whatever.
And some people have sex every hour.
Some people I will question that.
Well, I didn't say sex with each other.
Oh, okay. Again, I question that too.
No, it's true.
Right.
It's true. There are people who are compulsive sexually.
Right.
And there's people who masturbate compulsively, and people can do that, quite often, surprisingly quite often.
Exactly, and we know that COVID promoted that.
Well, yeah. I mean, if the person was open to masturbation,
Right.
It certainly provided them a greater opportunity to indulge themselves.
Yes, and some people who were against masturbation, they learned to accept that as part
That's
of
true.
Pleasure.
That's true.
Right. And then actually, I know of some couples that they never masturbated each other, but during COVID, they learned how to do that. So some of the, and I hate to say this, I don't want to say benefit, but being close to each other kind of changed a few things in a good ways for a group of people.
What's wrong with saying that?
Well, because we lost so many people, and
that's a different story.
That's a different story.
That has nothing to do, because in every change, I believe in every change there are both losses and gains.
Right. Exactly.
And so COVID was certainly a big change. There were a lot of losses, but there was a lot of gains as well. And what you're talking about is one of the gains that many people experienced, which is a sort of closeness with each other, and a learning to accept each other in a deeper way.
Right. That makes sense. Okay, well, thank you for saying that, right? So going back to the emotional factor, right? Some of the benefit of having regular sex with partners is improving self-confidence. When you feel secure in your relationship, when you feel that you're giving and receiving love, when you feel that intimacy just flows in the air, when you feel, you look forward to seeing each other and to cuddle and to get to each other, and you makes you feel that you're important, makes you feel you're wanted, makes you feel happy, and with all that, your self-confidence goes up.
Absolutely.
Right?
Absolutely.
Isn't that simple?
Well, also, as human beings, we want to be wanted.
Right.
And part of what we want to be wanted is our bodies.
Right.
Right. We aren't just our bodies, but we do have these bodies, and we want our bodies to be wanted by other people in a good way. and we want to be desired, and so our sexuality, as evidenced by the billions of dollars in the clothing and makeup industries,
Yes.
right? That's a lot of that is about, don't we want to be desired?
Exactly.
And of course we do.
You want to be desired, you want to look pretty, you want to look fit, you want to feel fitted in the society, you want to feel you belong to. So all of that all together gives us a sense of security, sense of connection, sense of being included, inclusion. And therefore, that's what we all most of the time, desire to have, right? We want to be included among our group of friends and families and loved ones and everything. And in particular, that is so important when it comes to our intimate relationship. So therefore, there you go. When you have regular sex, makes you feel good, makes you feel connected, makes you feel confident, and you have a strong sense of self-esteem and a strong sense of self-worth and a strong sense of your sexual self.
Absolutely. Absolutely. Right.
So we're in agreement with that.
We're in agreement.
We're in agreement with that. The second part of emotional factor is that, when people have regular sex and they are in a good intimate relationship and happy relationship, they're going to be able to learn about their bodies and what gives them pleasure, what gives their body pleasure. And that happens, of course, when people are having, healthy communication with each other, where they can, reflect on their body, when they can talk about, what's pleasurable for them and what is not, what works for them and what doesn't work for them, right? So having an awareness and a comfort level to talk about, the pleasurable spot in one's body is part of, it gives that sense of security again and pleasure, which definitely is related to how comfortable and how happy we feel, and that's our emotion.
Right.
Right. So we get a connection between feelings and body, and that's part of it. And then for those who would like to have irregular sex in their relationship, that's a sort of a strong sort of a bonding with your partner, right? This is how one is able to express affection, love, care, desire, wanting to be with each other, having a conversation of that magnitude. And therefore, the bond between the two of them seems to be stronger as they have regular sex at the level that they can emotionally connect with each other and physically, right? And not having any reservations about talking about pleasures and pleasure zones in their body, not having, holding back due to shame and fear or, fear of judgment or anything like that. Because when people are connected that way, all that negativity is just doesn't happen between the two of them, right?
Yeah, negativity occurs through pain.
Through pain.
Right. And when you're having pleasure, you don't have negativity.
Right.
And pleasure has to do with feeling safe physically and emotionally to be your loving, authentic, true self.
Right.
And the more you are your loving, authentic, true self, the happier you are. And the more you are your loving, authentic, true self with a partner who is their loving, authentic, true self, you have the synergy of the two that creates great connection, attraction, and people want to express that sexually.
Exactly. There are, some couples that, they don't know why this is not happening, even though they love each other. I'm going to go back to my prior example today that, I have this couple that, the way that they connect with each other is through gambling. So she does gambling for herself with her friends. He does gambling with his friends. And sometimes they connect, sometimes they don't. But that gambling connect, even though they are together, but the focus is not on each other. The focus is on just temporary relief of any stress that they have. So and then when they get together, they don't have sex, and they're wondering why,
Mm-hmm.
right?
Right.
So we know that couples who are having regular sex with each other, they have the least amount of stress level between the two of them or in their relationship compared to those who do not have sex.
In general.
In general.
In general.
Yes.
Yeah, I think that's true.
Yeah.
Yeah. Now, the gambling, what gambling does is it engages that part of you that is uh, that creates adrenaline.
Right.
And so you get a feeling of excitement through the adrenaline that's flowing. Adrenaline is part of what happens when we become sexual, but but with sexuality, the adrenaline gives way to other chemicals which change your physiology. It's sort of a high feeling.
Yeah.
When you're sexually aroused, it's a high feeling, but it's not a feeling of a rush, like putting dice on the table. Am I going to win or am I going to lose? So you don't have those spikes. You don't have the I won, oh I lost, I won. You don't have that. You have an altered state, but that altered state feels pleasurable and also is something that you can share. Whereas with the adrenaline rushes, you're not sharing it. It's not a
Right. It's
yeah.
not. It
So
belongs to you.
yeah. So even if people are gambling side by side, they're not really sharing that altered state.
Right.
Mm-hmm.
But they enjoy themselves for the time and for the duration. And then I also hear that some people, when they gamble 3 or 4 times or 5 times per week, per night, that I should say, because that's when the gambling happens, it impacts their sleep pattern.
Yeah, it can.
Yes.
Mm-hmm.
Because that adrenaline, as it is produced, it takes time for it to go down to the normal level.
Right.
And
Right.
that can keep the mind activated, and even if the body is tired and wants to go to sleep, the mind is awake.
Mm-hmm. Mm-hmm.
Right.
Yeah, the chemical changes are very different from when you're engaging in gambling than when you're engaging in sexuality.
Right. How long do you think it's going to take for that level of balance to happen after an episode of 4 or 5 hours of gambling, for a
Well,
person to be able to go to sleep?
yeah, I think also with gambling, you can get a tolerance.
Right.
So just like any kind of addiction, you need more and more in order to feel something, and your body sort of gets used to it. So if you've been gambling for a long period of time, for years, on a regular basis, I think that's different than if you're gambling once a month or twice a month, even if
I
you're
see.
doing, yeah.
Yeah.
So
That's a good point. It's a good point to know. But it's still, anything that goes out of its normality, right, becomes abnormal to body,
mhm,
and it has some sort of a side effect to
of
it,
course, yeah,
right? Yeah.
absolutely.
So aside about emotional factors, that is a benefit of positive emotional factors, that's a benefit from having regular sex. There are also physical benefits for that. For example, we know that it boosts immune functioning.
It does boost the immune functioning. Yes.
Right.
Uh-huh.
Right. And then basically those that they have sex more frequently, they get sick less often.
Mm-hmm.
Because they're happy. The body functions in a happy way. All the hormones or happy hormones are all functioning all the time.
Well, it's true. Yeah, and that book that I've referred to before, that was written, I believe, in the '60s, called "Anatomy of an Illness,"
Right.
By Norman Cousins, who was a physician who was doing research on cancer and developed cancer, and realized that certain hormonal changes in the body allowed for cancer to enter, and also allowed for cancer to grow. And these had to do with negative emotions,
Right.
fear, sadness,
Yeah.
chronically, not just having those feelings, but chronic fear, chronic sadness, chronic disappointment, the chronic anxiety, depression. Those open the body up for opportunistic infections such as cancer. And then he felt, well, okay, if that's true, then perhaps positive emotions could help it. And he actually cured himself of cancer by creating uh, by locking himself into a room where he had a lot of comedies and just was laughing like most of the day. And the people around him, the other physicians, couldn't believe it, but actually it did cure him of the cancer.
Yeah, yeah,
Yeah.
I've heard that this
And
story.
he wrote that book about it, which is phenomenal. And now, of course, in the 2000s, we know that that's a fact. That
That's a
positive
fact.
emotions and positive feelings are very curative.
Yes. And here's another good news. It can be a form of a light exercise
Light exercise.
and a calorie burning,
Hmm.
right? We know that, on average, an episode of sex running about 15, 20 minutes, people can burn up to 250 calories.
Hmm.
It's better than any treadmill.
Yeah, yeah. I think a lot of that has to do with who's on top.
Well, okay. All right. Well, Dr. Jaffe likes to crack a joke all the time.
Who's doing
right?
the work?
Who's doing the work? And so you ask yourself who's doing the work and who's burning the more calories.
That's
here.
right.
So we are about to end our program, and I'm not even half through what I wanted to say. Maybe I continue with this next week, but I'd like to hear from you at the same time, so you can guide us about what to offer you. So I'm going to invite you to please join us at 4 o'clock today so we can listen to another episode of Codependency, Trauma, Addictions, and Relationship with Dr. Robert Jaffe and myself. And don't forget to join us again next Tuesday at 3 o'clock for another episode of Thursday for another episode of Human Sexuality. And until then, all you need is love.
All you need is love. See you soon.
See you soon.